Welcome to the Trinity Health IHA Medical Group Wednesday Wellness Series. This presentation is titled Lifestyle Medicine, Plant-Based Health and Nutrition, Top 10 Things You Want to Know. And the presenting provider is Trinity Health IHA Medical Group Family Medicine and Lifestyle Medicine physician, Robert Breakey. Dr. Breakey is a diplomat of the American Board of Lifestyle Medicine and serves as the medical director for Trinity Health IHA Group's William J. Folletti Center for Lifestyle Medicine. He sees patients at the recently launched practice, Lifestyle Medicine Primary Care, in the Arbor Park Medical Center in Ypsilanti. Welcome, Dr. Breakey.
All right. Thank you, Allison. I so appreciate you and appreciate all our guests tonight joining us for this evening's seminar. Got a lot to cover. As she mentioned, it is being recorded, so don't feel like you have to take frantic notes or screenshots, but feel free to take notes or screenshots as desired if you want to use those to ask questions. We'll have time at the end for plenty of questions. As such, though, I'll go kind of quickly. I want to cover quite a bit, and then we'll have time to re-review, or you can watch it again on the after run. So with that, let's go ahead and do the share screen with Allison. Are you seeing my screen here?
Yes, looks great.
Top 10 things you want to know. All right, thanks. As Allison mentioned, I've been a family lifestyle medicine physician in the Ann Arbor area now for 39 years, always with an interest in getting to the root cause and trying to see where and how we can prevent or where possible reverse most of the common chronic diseases I see in my office every day. And you may have seen some of my previous seminars. This will stand alone, but also build on those. And if you see information that you like to follow up on, or re-review, the previous recordings are also posted. So point number 1 out of 10 is let's review what's at stake, unintended. We see in the media a lot of industry-sponsored happiness, like from Coca-Cola, McDonald's, Pizza Hut, gather around the good stuff, beef, it's what for dinner. We've heard all of these, but where are all these getting us? What is the result of these marketing campaigns that so often are pushing foods that are degrading our health and pulling us into a country with really high costs, but overall poor outcomes when you look at things like chronic disease rates, longevity, and medication use. We are a nation of ill people, and fortunately, that's largely preventable. I like this little graphic from the book You Staying Young with quality of life up along the side here. We all start out with good quality of life, or most, and then maybe an acute illness in middle age or so, and then commonly a little overweight, hypertension, and bam, dead by the age of 78. What instead, if you could follow up and to the right there on the dotted line, get struck by lightning at age 103 on the golf course, you're still going to end up in the grave, but instead of 10, 15 years of suffering, decline, and immobility, you've got 20, 30 years of extra quality life to spend doing what you want. I like this little video too. Let me just play this 1-minute video to help us. Oh, you know what, Allison, I forgot to click the boxes, so let me go back and make sure we do that, because I want people to hear the sound from this too. Oh, looks like they are clicked because it stayed that way from previous. We'll jump down to here.
And Dr. Breakey, we are seeing like the control panel up there. I'm not sure. Is it
Back now? Oh,
yeah.
I see. You're getting the control panel too. Let me try this. I apologize for the glitch. Let's try sharing and getting this one instead. Is that better?
Hang on 1 second. Let's see. It's still showing, but let's.
I think this will still work for this one.
Yes.
Let's go through this video.
And let's do that, and then we can adjust.
Here we go. Oh. Let's start from the beginning. Okay. Can you hear it too?
Yes.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every...
Sorry. Trying to close this little window altogether.
moment. Will you grow old with vitality? Or get old with disease? It's time to decide.
So here's a sad reality is that most people will be the one on the right. And it's just, in fact, kind of assumed to be a normal consequence of aging, in the sense that we kind of say, hey, just get your long-term care insurance. It's just what's going to happen. But in reality, the therapy of lifestyle medicine through these 6 pillars has a chance to significantly shift your odds of being the one on the left, where everybody wants to be with a healthy, active later lifestyle. These therapy is put forth by the American College of Lifestyle Medicine talk about nutrition, good quality sleep, movement and exercise, avoiding risky substances, appropriately managing stress and healthy relationships as the cornerstones of the prevention and treatment, in many cases reversal, of many of the most common chronic diseases we see. Unfortunately, the standard American diet has now become the greatest cause of death and disability in the U.S., surpassing tobacco as of 2018. As smoking rates have decreased and the American diet continues on, this will be the main focus of much of what we talk about this evening. If we think about food in 4 categories, animal on the left, plant on the right, unprocessed on the top, and processed on the bottom, you get the idea. Down here is the processed animal foods like hot dogs, cheese, and chicken McNuggets. Up here, at least, it looks similar to the way nature presented. Down here is processed plant foods with the origin from plant, but often high in fat, salt, and sugar, and designed to bring us in, keep us coming back for more, but not really healthy. And then up here, fruits, vegetables, whole grains, beans, nuts, and seeds. So you see the dividing line between health supporting and health degrading. It's not so much one half or the other. Like if someone says, I'm vegan, I don't eat anything on the left. Well, good for you, but you could still be vegan and eating French fries, potato chips, Coca-Cola, and Oreos. Or I'm paleo, don't eat anything processed. Well, good, but you could still be eating a lot of the animal foods that have lack of fiber and phytonutrients, are high in saturated fat, cholesterol, and animal protein. So keeping that in mind, we now know that the consumption of the meat, dairy, eggs, and processed foods increase systemic inflammation, clog the arteries with heart disease and stroke risk, can create insulin resistance, setting people up for diabetes, contribute to several cancers, among those colon, breast, and prostate cancers, imbalance the microbiome, so the healthy bacteria in your gut that support your health as a community, create acid stress on the kidneys, and we'll come back to that, bone loss, shortened muscle recovery, and essentially premature aging, cognitive decline, and Alzheimer's. So significantly increasing the chances that in this short video, you'll be that one on the right. And this really, though, is good news because, again, although the party line is, well, sorry, it's just random luck, get your long-term care insurance and get ready for debility and old age, you can significantly improve your odds of being the one on the left through these lifestyle measures. So that's what's at stake for you. But there's an even bigger risk because these foods also contribute significantly to greenhouse gas emissions, water use, topsoil erosion, excess pesticide and environmental degradation. So we see that by eating healthy in a whole food plant-based manner, you're not only improving your own chances, but for that of future generations. And many of us, like me, have a key stake in this as these are my 3 granddaughters. And I want the world to be a better place for them. So what's at stake is huge for yourself and for future of humanity. Next, number two is that not all protein is created equal. I think we're all familiar with good carbs and bad carbs. We understand that if you eat lentils and broccoli, those are good carbs. If you eat sugar, sweets, white bread, cake, candy, and donuts, those are the bad carbs. Similarly with fat, I think most people recognize that trans fats, cholesterol, saturated fat are not near as healthy as the unsaturated and especially the omega-3 fats. So we have that concept for good and bad fats and carbs, but not many people recognize that there's also good protein, bad protein. Well, let's back up a little and think about where do you get your protein, because you can't be plant-based or even think about it without well-intended people asking you, no, you're going to die of protein malnutrition. We worship protein and think that you need lots of it. The more the better, but it's quiz time. Which of these have protein? Well, with this audience, I'm sure you got it right. All of them. DNA codes for protein. So every cell of every living thing contains protein in more than adequate amounts. We only need about 5 to 10% of our calories from protein, and these whole plant foods easily surpass that. Here you can see it, that more ideal diets, like we see in the blue zones, are 70 to 80% complex carbs, about 10% each fat and protein. And these animal foods are way unbalanced, having no complex carbs and high amounts of the protein and fats. We used to think also that protein from animal foods was what was called, quote, high quality. It more closely matched the amino acid makeup. All proteins are made up of 20 different amino acids, and 8 of these are what are called essential ones that our bodies can't make. So the theory became, well, these animal foods more closely match those that and have larger amounts of those essential amino acids, so they must be higher quality. And then came a myth out of the 70s that in order to get complete protein, you needed to combine foods like rice and beans together. We now know that just like for horses, chimpanzees, and other plant-eating animals, high quality protein, as that is defined by that is with health supporting for humans, comes from plant foods. All 8 essential amino acids are present in all plant foods in optimally balanced amounts. And when I say optimally balanced, what we'll see is that they are actually imbalanced in the animal foods compared to what is health supporting. In addition, we recycle about 100 grams of protein every day as billions of our cells die and billions of new ones are born. And this recycled amino acids are, by definition, the exact ones we need to build the new cells. So we only need to kind of top this off with about another 45 to 55 grams a day, a little more on average for men or people working out. But this is the RDA of 0.8 milligrams per kilogram of protein per day. Most people eat 2, sometimes 3 times that amount. Again, we'll find out with detrimental results. In addition, we don't just eat protein, we eat food. And everything macronutrient, protein, fats, or carbs, come along with what else comes in that food. So different foods have different amounts of fiber, sodium, and it's the package that really makes the difference. So if you get your protein from plant foods, on the left there, you see that it comes along with complex carbs, which are the cleanest burning energy source, a great nutrition value, abundant antioxidants, an average of 1,100 units versus only 18 for the animal foods, plenty of fiber to nourish your microbiome, phytonutrients, tens of thousands of additional nutrients in foods that phyto means plant, so only from plant sources that help support immune function and decrease inflammation, the healthy fats in terms of the omega-3s in foods like flaxseed, walnuts, hemp seeds, in terms of more polyunsaturated fats, rich in vitamins and minerals, especially for fruits and vegetables, but all plant foods, and then a good balance of macronutrients, as we talked about, that is the fats, carbs, and proteins. In contrast, animal protein comes along with bacterial endotoxins. An average quarter pounder has 100 million bacteria on it. And these mostly die in cooking, but not before they form these endotoxins that are strongly inflammatory when they get into your system. As I mentioned, they have minimal antioxidants to help put out the free radicals formed by extracting energy from food. They have no fiber to nourish your microbiome. This is really critical. They have no phytonutrients and are commonly high in saturated fat, and are the only, now that they have banned trans fats from processed foods, only the naturally occurring in meats are what most people are getting their largest source from for these fats that cause heart disease and cancer. Carnitine and choline in meat and eggs, respectively, metabolizes to trimethylamine oxide. We'll come back to that. And then heme iron, mostly in red meat and shellfish, is a strong pro-oxidant, creating free radicals and systemic inflammation. So the protein consumed from animal is also much more acidic. This is due to two particular amino acids, cysteine and methionine, that contain sulfur. These metabolize to sulfuric acid. Plant are actually alkaline, especially fruits and vegetables and beans. And the consequence of this is that these excess acid in the body from eating all these unnatural animal foods has to be metabolized by the kidney, putting a strong strain, especially for those higher in protein, like fish, pork, and poultry. So this is a common contributor to chronic kidney disease. And when the kidneys start to fail, toxins build up and other concerns can establish throughout the body as well. The second is much more allergenic because these proteins are more like ours. They can cross across our intestinal barrier, setting up an immune or even autoimmune response. Milk and eggs are the leading cause of food allergies. Also, fish and shellfish are common ones, so much more allergenic. I mentioned some about inflammation, and this really is the root cause of many of our common concerns, including atherosclerosis, insulin sensitivity, even several cancers and immune dysfunction. And you can measure, when you give people animal foods, inflammatory markers like interleukin-6, C-reactive protein, and inflammatory cytokines increase. This really is a root cause of much of what we see, and the animal proteins are at least in part responsible for this. In fact, you can measure inflammation through people on different diets. And as you can see from after 2 months on a vegan versus pesco-vegetarian versus semi-vegetarian diet, it's a stepwise faction for the anti-inflammatory versus inflammatory index of the food intake. Makes a huge difference in many diseases. And then finally, the protein in animal foods stimulates a hormone called IGF-1. This is a growth hormone, which the only time we're really meant to have animal protein in our diet is right after we're born. Mother's milk, of course, is the ideal food for infants, and it stimulates this hormone so that they can triple their birth rate in the first year of life. After that, if we take animal protein, IGF-1 is counterproductive, and especially with respect to cancer. We know that higher animal intake gives measurably different levels of IGF-1 in the bloodstream. And in this study, following people over 18 years, those aged 50 to 65 with a higher protein intake, I should say animal protein intake, had a 75% increase in overall mortality and a 400% increase in cancer death over the following 18 years. These were abolished if the proteins were plant protein. And we now have a clear mechanism for this because IGF-1 is like kerosene to a fire to cancer cells. If a cancer cell forms as a result of a random mutation, virus, or environmental infect, then much more likely to double more quickly, to spread, to grow, to develop what it needs to take root and cause challenge. So people on higher animal protein have a much higher incidence of cancer, several cancers, especially breast, colon, and prostate. Now also animal protein's been linked with diabetes, largely as a result of the higher content of methionine. This particular amino acid is much more prevalent, 3 to 5 times more in meat versus beans, fruits, and vegetables, and increases insulin resistance It's kind of an pro-aging amino acid, and we'll come back to this one as well. In addition, valine, leucine, and isoleucine, the so-called branch chain amino acids, have a similar adverse effect and much higher in the animal proteins. In addition, animal protein inhibits the production of FGF21. We're going to come back to this one, so I'll leave it for now. And as we mentioned, stimulates the increase of IGF-1 levels, in particular these amino acids stronger than others. So the bottom line then, how does this work in the real world? Nice to have all the science behind it. But if you look at all-cause mortality, which is prediction of dying or not, you see that on the graph on the left is for heart disease mortality. As the amount of animal protein in the diet goes up from 5% of calories to 25%, 30% increase in the risk of cardiovascular mortality. The opposite is true from plant proteins. As the amount of plant protein in the diet goes up, down goes the risk of dying. So we see this clearly in these population studies as well. In fact, just replacing 3% of energy from protein sources can lead to significant animal to plant protein sources leads to a significant decrease in all-cause mortality. The biggest changes were for processed meat, and second is eggs, but the others also had significant difference in mortality from the range from between 6 and 34%, as you see. So the conclusion then, replacing 3% of your energy from various animal protein sources associated with a 10% decrease in overall mortality in both sexes. This was from an AARP study of 400,000 participants. If you want to see a little more, this is a short video from Dr. Greger. Again, either a screenshot or point your phone. Just a few-minute video outlining the importance of switching from animal to plant. So let's next. Back in the day, we thought that animal fat was the source of all challenge, from blood pressure to diabetes, heart disease. Well, we now know, and so it was industry to the rescue. Low-fat cottage cheese, skim milk, fat-free ballpark franks, egg beaters, which are mostly egg whites. And now we know that animal protein is associated with several cancers, kidney disease, diabetes, and coronary artery disease. So it's not just don't look for lean meats and low fat, this and that, switch to the plant kingdom. Key take-home point there then, for health, swap animal to plant protein, and you'll do much better over the long run. Next is number 3, anatomic loss or physiologic strain. Back in 1972, Dr. John Travis introduced the idea of the illness-wellness continuum, where people start out with, you can see a neutral point there. And then as you go down to the left, developing signs, that is things that we can measure but you don't feel. Symptoms are things you feel, and finally disability, premature death. Instead, our aim is to go toward the right side there with growth and high-level positive wellness. But along these lines, we can think of an example that I think everybody can easily understand, and that is smoking. In the subclinical, kind of before you even see anything or feel it, it's causing systemic inflammation and tightening of the arteries. As it progresses, signs develop where we can measure a blood test that looks for the amount of carbon monoxide poison in the bloodstream of smokers, compromised lung function on lung function tests, and stiffening of the arteries on ultrasound. Progression still might lead to chronic cough, shortness of breath on exertion, sleep disturbance, and then finally a person is diagnosed with smoking-related illness, coronary disease, chronic bronchitis, or peripheral artery disease. And then it's still continued with it is where you get over the hill on the anatomic loss. A heart attack is death of the heart muscle. Emphysema is the lungs breaking down so they can't be repaired, or a stroke with loss of brain. So with that kind of as example that I think we can understand, think now about this crossover point where the anatomic loss is not yet there, and as we explore about meat, dairy, and eggs. In the subclinical phase, we talked about the systemic inflammation and imbalance it creates in your microbiome. Later, blood tests are to show an elevated cholesterol, blood pressure, and blood sugar. Next symptoms, maybe some chest pain on exertion, excess thirst or urination with prediabetes, fatigue, and then finally a person is diagnosed with these diseases. Now, what I'm getting at here, though, is that these are still not over the hill yet. If we come down here and a person has a heart attack, develops blindness or amputations, end-stage kidney disease or stroke, metastatic cancer, Alzheimer's, these are no longer reversible. But until you get to these points, these are not really so much diseases in the sense that you're going to have it forever. We call them chronic diseases and treat them as if they're already there and all you can do is manage the symptoms. But we know that they're treated as anatomic loss, but we know in many examples, like for example, Dr. Esselstyn's work, that even our leading killer, coronary artery disease, is commonly reversible by getting to the root cause, the standard American diet, not smoking, exercising, managing stress. This is a 43-year-old surgeon from the Cleveland Clinic. On the left is an angiogram, an x-ray of his large artery serving the front side of his heart, all ragged and clogged with atherosclerotic plaque. And then 3 years later, wide open. The body went into healing mode. So he had not yet had the heart attack. He was in that stage right before it, where previously we thought was irreversible, and now we know can be reversed. Dr. Esselstyn calls coronary artery disease a benign foodborne illness, which may never exist or progress. Similarly, with chronic kidney disease, this is one of my patients. I changed her name just for the purpose of presentation. And this graph shows her kidney function. The line at the top there is normal at 60, dropping off quickly over between 2012 and 2017. She was headed down towards stage 4 chronic kidney disease. And about this time in 2020, I told her, if it keeps going down, you're going to end up on dialysis. She said, no, I'll do what it takes. Help me. As I mentioned, animal foods are strongly challenging for the kidneys as a result of the inflammation, the atherosclerosis blocking the arteries to the kidneys, and the acid that they have to manage from the excess sulfur containing amino acids. So she went on a whole food plant-based diet, and we changed EMRs about that point, so you see it, but it's still the same scale here. Her kidney function improved significantly over the next 6 months. She then fell off the wagon with some significant life stresses, headed back down again towards stage 4, and finally said, that's it, not going there anymore. And you can see that her kidney function improved back to her baseline of almost normal. So something we've historically assumed as, hey, chronic kidney disease is there. It's once it's gone, it's gone. And that is true when you get loss of nephrons. That's called the anatomic loss. Those are the filtration components of kidneys. But until then, there still may be hope that some of them are just strained to the point where they could recover, as was the case in her example. So just like a smoker's cough can get better from quit smoking, coronary artery disease, diabetes, obesity, hypertension, precognitive decline, and even in many cases, chronic kidney disease may potentially be reversible with a therapeutic dose of lifestyle approach. I emphasize it has to be therapeutic dose. You can't just think that, I'll go on a Mediterranean diet and still eat fish, cheese, and olive oil. You may need to be more strict than that in order to get these kind of results, but it's available for anybody who wants to explore that option. And we'll give you some resources on this throughout. So this, because of the rich antioxidants, the microbiome supporting alkaline, anti-inflammatory, and balanced macronutrients, we see some really quite excellent results with lifestyle approaches to many of the diseases I see most common. Number 4, I say avoid the downward spirals that can happen as you get into this. And probably an easy one for people to understand is that animal and processed foods are very calorie dense, They lead to an imbalance in the microbiome because they don't contain fiber. And this can cause obesity and inflammation, which then leads to a degeneration of the cartilage in the knees. And we call it arthritis. It's kind of almost expected or normal that you're going to need a knee replacement by the time you're, in your 60s or 70s. So many people do as a result of this. But the real problem then comes that people with this arthritis get pain with walking, inactivity, which contributes to even more challenge losing weight, more degeneration, more arthritis, and around it goes. So again, a simple example of how the downward spiral, once it gets going, can really continue to be self-perpetuating. Here's a little more complicated one for the folks who really want the science. You can go to the article that's listed here, but here's the TLDR. When you eat foods that are high in fat and animal proteins, the fat deposition in the liver results in elevated blood sugar levels as the fat spills over into the bloodstream and goes into the muscle cells. This results in more fat deposition, resulting in more insulin resistance, resulting in higher blood sugar, resulting in the deposition in the pancreas, and the decreased response to the carbs in food, increased blood sugar, and back up to increased fatty liver. So you see how it kind of goes around in a sense that we're become self-perpetuating once you get that going. Again, may still be reversible in the physiologic strain phase, but much better to not to have to go there. Next is a higher white blood cell count as another example of a downward spiral. If you look at people with who eat meat, dairy, and eggs, they have a higher white blood cell count. These are the immune system cells within our bloodstream that go around helping to get rid of invaders and our immune function. And because of systemic inflammation, they have a higher number of these in their system. What this means then is that they can get stuck in the blood vessels. There are much larger numbers of them, and the inflammation makes them more sticky. The average blood vessel is only 5 microns wide, but a white blood cell is 7. So they have to kind of squeeze through. If they do get stuck in there and can't go on, they end up breaking open and they spill many of the contents of their kind of warfare that they would use to take out harmful bacteria into the bloodstream, increasing inflammation. So here it is, either pro-inflammatory foods or smoking can increase inflammation, elevating the white cell count. Inflammation makes them sticky. They get impairing blood flow to tissues, which creates more inflammation for the tissues and traps the leukocytes, creating more systemic inflammation and ultimately leading to many of the common diseases, including heart disease, cancer, fatty liver, etc. So downward spiral, once again, triggered by the processed animal foods and or smoking. Next is TMAO. I mentioned that carnitine in meat and choline in eggs metabolizes in the gut by bacteria in the gut of people who eat those foods to trimethylamine. This is oxidized in the liver to trimethylamine oxide. Bad actor. This is very pro-inflammatory going throughout the body. And the kidneys are particularly susceptible to this inflammation. And as they become compromised by TMAO in the system, and by the way, you can measure this 2 hours after an Egg McMuffin meal, TMAO levels rise significantly and blood vessels stiffen by 50%. The kidneys are particularly susceptible to this, which leads to their lowered ability to clear TMAO from the system, leading to even more inflammation, leading to more strain on the kidneys. So the point is, don't get started in the front of this cascade. Be nice to your kidneys and decrease your overall inflammation. So no downward spirals. Next is enhance your FGF21 levels. In the year 2000, a new hormone was discovered called fibroblast growth factor 21. It was the 21st FGF1 discovered, so that's the name. Not yet a household name, but we're going to help make it such because it's a really amazing hormone. It promotes metabolic and artery health, decreasing risk of high blood pressure and diabetes, supports optimal weight goals by increasing the burning of fat in the fat cells, and actually has been termed kind of the longevity and health span hormone. The pharmaceutical companies saw this and they were salivating about the idea of, oh, we're going to give people FGF, we're going to synthesize it and put it in a pill. Well, you guessed it, it didn't work. It had bad side effects. It only lasts about 1 to 2 hours in the system, so you'd have to dose it every couple hours. Much better to see how we can stimulate our own internal FGF. Again, for those with wanting a deeper dive, here's some of the science behind it, where the low protein and high carb diets, which are characterized by a whole food plant-based diet, or fasting, stimulates FGF21, increasing thermogenesis, that's burning energy for heat instead of storing it, and helping us to regulate glucose sensitivity and many of the pathways of aging from this. So it can help prevent or reverse high blood pressure, diabetes, obesity, several autoimmune disease, and slow aging. Pharmacy has for long kind of thought about if we could just get a pill that would treat all these things at once. Well, nature beat them to the punch, because there are several ways that FGF21 helps by amping up our AMPK, which helps to increase our metabolism at a cellular level, enhancing metabolism and lowering mTOR in our system. And the ways that we can do this, practically speaking, are exercise with both aerobic and resistance training, significantly increasing FGF21 levels, resistance training being the better of the two. Fiber in the diet, only from whole plant foods, increases your microbiome short-chain fatty acid called butyrate, which has a strong enhancing effect for FGF21. You can also do it by food restriction. We've known a long time that calorie restriction can help animals and humans live longer. But when you narrow it down, it's not just all food, it's protein restriction, not to lower than needed, but to the recommended amounts instead of twice like most people are eating, and specifically animal protein intake. By eliminating animal protein, you can see an increase of FGF21 of 150% in just 4 weeks. So many ways to help stimulate this enhancing hormone in your system. And again, here's a couple of great videos from Dr. Greger if you want to learn more about this. I think it's, again, an amazing way that our bodies use to help keep us in balance. Number 6 is understand the backlog effect. A lot of people see these amazing results in studies and they say, why is a plant-based diet not working for me as fast as it did for them? Well, so often what you've eaten over the years is stored, and that comes out as it mobilizes. As you lose weight, that same saturated fat, environmental contaminants, trans fats that you've eaten in the form of meat, dairy, eggs, and processed food over the years remobilizes and can have still some adverse effects and a tail effect. Don't get me wrong, it's good to mobilize that to get it out, but it's going to take time. One way to help calculate your backlog is what we call your SAD years of unhealthy eating. And the analogy here is for smokers, we do what we call pack years of smoking. This shows the risk from their past habits. A half pack a day for 40 years would be 20 pack years of smoking. 2 packs a day for 15 would be 30. You get the idea. And higher the pack years, the greater your risk of emphysema, heart disease, cancer, etc. Similarly, with your SAD years, this is the backlog you carry from the percent American diet. And using me as example, my first 20 years, I ate horrible standard American diet. I didn't know better. So we'll give me 100% standard American diet for 20 years. 8 years I was vegetarian, and then chose whole food plant-based for 30 years. So I'd have 24 years of SAD years of adverse eating. It helps to kind of give an idea of what you've got going in the backlog. And a good way to help assess this is called the 4-leaf survey. I do this with all of my lifestyle medicine patients to be able to say, what's your current diet as far as percent whole food plant-based? And you get a score from 1 to 4 leaves, I should say, from 0 to 1. The average American scoring -20 on this score. But try this survey. Just Google 4-leaf survey, and you'll kind of see where you stand right now as compared to where you may want to be. Remember also the whole food part of your whole food plant-based lifestyle. Some people are vegans for ethical or other reasons, and again, good for them. But you can't just use Beyond Meat burgers, which are very high in saturated fat, or potato chips, French fries, so fat, salt, sugar. Choose whole grains, blend, don't juice if you're going to have a smoothie, and minimize your supplements, but do take B12. I noticed someone in the questions had put that. We'll come back to supplements, but enjoy real food. That's the way to get your nutrients and have fun with it. New recipes, cultural dishes, and foods can make exploring healthy eating fun and inviting. Related to that, people often ask me, well, what do you eat? And this is my breakfast pretty much every morning. If you've read Dr. Greger's books, How Not to Diet and How Not to Age, he gives a lot of pearls of wisdom like, hey, you should have turmeric for inflammation. You should have walnuts for omega-3s. Well, I kind of put those together in my recipe with some quick cooking steel cutouts, goji berries, and the oatmeal provides fiber, proteins. Avenanthramides are especially active anti-inflammatory agents. Don't let anybody tell you oatmeal is not a healthy food. It's one of the healthiest. Goji berries are great for vision. Soy milk with the soy proteins. Similarly, the dairy and meat industries have tried to vilify soy, but it's protective for breast cancer, for PCOS, for menopausal transition. The isoflavones in there, phytoestrogens, anti-cancer and anti-aging. So these all come together in my oatmeal. And then on top, I add ground flaxseed, which is a great source of omega-3 fatty acids, lowering blood pressure, improving immune support, fighting cancer, and improving prostate health. Wheat germ also is anti-aging through a special phytonutrient called spermidine. Ground chia seeds, some cinnamon for great taste and antioxidants. Amla powder is the strongest antioxidant food. It's from the dried Indian gooseberry. Got a little bit of a bitter taste, but amazing effects for lowering cholesterol, enhancing immune function. And I just put these all together once a week. I don't do it every day, but it takes me about 15 minutes to put this together. I add some turmeric. By the way, amazing food. Anti-cancer effects has been used for ulcerative colitis, several cancers, anti-inflammatory for arthritis, largely related to their curcumin. But don't just get a curcumin supplement. It doesn't work as well as actually using the whole spice or the root itself. Ground pepper potentiates the effect of turmeric, and you only need a pinch of it. Matcha is green tea with great anti-cancer and longevity effects. Cocoa for the flavonoids, cranberry, polyphenols, etc. Anyway, you can go back through this and see, you don't have to do all this, but here's what I do. Add these all together, put them in a sealed container in the fridge, and then it's ready to go each morning on my oatmeal. And then top it off with some cherries, walnuts, whatever berries I have around. Maybe be sure to include some barberries because these are really strong in antioxidants, and the active ingredient berberine has a good effect to lower cholesterol, blood pressure, and improve insulin resistance. But all berries are very healthy. Fruits are among the healthiest foods, and berries are among the healthiest fruits. So there it is. Get dessert for breakfast every morning. And bonus, if you're using Dr. Greger's Daily Dozen, highly recommended, by the way, you get to check off 6 boxes right away at breakfast. The little QR code in the bottom there has, it's an app for your phone that just helps you to kind of focus on what to eat during the day. And as you check these boxes off, you'll be getting great nutrition. Next is some people actually feel worse when they go vegan or plant-based, and it's important to understand that. There's several reasons for this. One is that your microbiome, the bacteria in your colon, are actually helping you to digest the fiber in foods. But if you haven't been feeding them, if you haven't been eating any beans, which average American eats very little, then those ones that feed on that aren't there. They haven't been fed. They didn't show up. So the fiber and resistant starches go down and ferment, creating gas, bloating, discomfort, people say, oh, I tried that and it didn't work for me. Well, they need to go more gradual. Sometimes we start with just a teaspoon of canned lentils per day for a few days and then go up to a tablespoon, finally working your way up so that those microbiome that help you digest those come back and can support you. Next is that fat, salt, and sugar trigger dopamine in the brain. And just like withdrawal from heroin or alcohol or nicotine, these are a very similar pathway, and you can get almost a withdrawal symptom from cutting back on these heavy calorie dense and processed foods. Feeling worse for a bit, but just like folks getting over those drugs, feeling much better in the long run. Next is carnitine. This is a substance our muscles need, and our body makes all we need to function for our muscles. But if you're eating it in the form of animal muscle, where carnitine is present, then your own factories get lax. It's a feedback loop and says, well, plenty of carnitine around, don't need to make this. As you cut back on the carnitine you're taking in, it's almost like a carnitine withdrawal. Your muscles may feel a little weaker for a while until they get back up to being able to produce what they need to function properly. And then finally, just psychological stress. It's not easy being different, kind of helping people understand you're doing this for your health. They think you're going to die of protein malnutrition or have health challenges in the future. So that can be challenging as well. All I can say is go gradual for most people, stick with it. The benefits are so great, and have just dozens and hundreds of people over the years who said, I'm so glad that I did this and feel so much better over time. So stick with it. The next is 9 is protein density. And it turns out that the typical American diet with, say, fruits, vegetables, grains, protein, might look something like this. And it looks like, wow, good for you, have fruits and vegetables, right? Well, maybe by volume, but if you look at the calories in the broccoli, only 30, and 90 in the apple, 150 in the milk, you get the idea here, 240 in the salmon. The number of calories from whole food plant-based is only 120 out of a total of 670. You're only 18% whole food plant-based here as far as percent of calories. So the calorie density makes a big difference. If we reframe these by the way our brain usually thinks about it, by volume, you're getting most of your foods from these processed and animal sources rather than the whole food plant-based source. By the way, chicken is not a health food. People think of it as a good protein source, but currently they've obesified chickens now, and it's many studies now is no better than red meat. Chicken is only about 40% protein, and as we mentioned, that even that component has challenges of its own. So here it is from the American College of Lifestyle Medicine, looking at various foods and their calorie density. Only 100 calories for most vegetables, whereas beef, 1,000 calories. Processed foods, cheese, 1,700. And finally, oils, 4,000 calories per pound. So you want to eat more of the low calorie dense, high nutrient value foods if you want to maintain your weight and lower your risk of chronic disease. Corollary to that is avoid messing up a good food. I.e., what if you put just a little cheese sauce on that broccoli? And if you look at the cheese sauce, a third of a cup of cheese sauce, because of the butter, milk, cheddar cheese, is 230 calories versus 30. And it also includes a lot of total and saturated fat, cholesterol, and sodium with no fiber. So you've just changed this whole food plant-based meal to only 12% whole food plant-based, even though 3/4 of the volume is broccoli. So you think you see the concept there. You can easily mess up good food with small amounts of processed or animal foods. It doesn't mean you have to eat your broccoli plain. I mean, you can use nutritional yeast on there, balsamic vinegar, spice it up with Italian spices, put it in a curry, stir fry. I'm not saying you have to eat it plain, but use plant-based, whole, healthy sources rather than fat, salt, sugar, and animal foods. Here it is, just volume-wise. You're getting a little teeny bit of broccoli and a large amount of the cheese with it when you look at percent of calories. It gets even worse because many of the benefits of certain foods like coffee or tea are canceled out by the casein in milk, similar with berries and chocolate. So these unique phytonutrients that give great value no longer active once you put milk or dairy in there. So if you got to have something in your coffee or tea, make sure a plant-based source, which does not have that effect. So reconsider. Broccoli and cheese could be the nutritional cheesy sauce. Coffee, tea could be soy milk instead of ranch or oil dressing, 18-year balsamic, and then veggies and ranch could go to veggies and hummus. And then finally, number 10, this is not so much what is, but some predictions that many are making, is that AI will disrupt U.S. healthcare and nutrition research. We know that keeping up with large amounts of data, diagnosis, and and in addition, really true evidence-based care, because AI will be better at keeping track of the root cause instead of just what you've got going on. AlphaFold and nutrition research is notoriously challenging because it's hard to take, a group of 1,000 people and do a double-blind experiment and have them not know whether they're eating broccoli or not, and follow them for 20 or 40 years. But we've now got AI that can predict the folding patterns of proteins. And this has been a huge breakthrough because it helps science to develop new medications and understand pathways much better. The next level, though, is the structure and interactions of all of life's molecules. So proteins, fats, enzymes are getting increasingly predictable. And as we're able to predict the effects on a microcellular level, a cellular level, an organ level, and finally an organism level, we'll be able to much better do research that will help us to understand that true optimal human nutrition is related to whole food, plant-based eating. The big data analytics, this is, by the way, asking ChatGPT-4, will AI enhance nutrition research? Image recognition will allow us to more accurately see what we're eating, portions and amounts. Predictive modeling will help us to see what these patterns will result in and give people a better idea of what I should be doing differently. My wife got some of these Meta glasses, and I'm sure it won't be long before the camera on there is telling her, you should choose the bean burrito versus the beef because you've had this much today. And people get insights from wearables and analysis that will help them to make better decisions in a customized way. Nutrient bioavailability will be better matched, and pattern recognition to help us do studies and develop recommendations. So bottom line, by harnessing the power of nutrition research can make significant strides to help us better manage and understand what's going on inside our bodies and future health goals by giving us more information to go on. So excited about that. Bottom line, I think a fundamental paradigm is sweeping across the nation, put forth by the 6 pillars of lifestyle medicine. Really, I think it's ours for the taking. Some additional resources here with Physicians Committee for Responsible Medicine. Several places I've talked about Dr. Greger's website, nutritionfacts.org, all free, no banner ads, and evidence-based without a hidden agenda. Forks Over Knives, plant-based nutrition support group. Here's the easy go for those if you want to take a screenshot or come back to it to go to these resources. Because again, we're really in this hour only having time to scratch the surface. A special note to Dr. Greger, nutritionfacts.org, and his books, which are some of the best available on these topics. And finally, as I finished last time, I think we can all understand that a tree growing in healthy soil that's not compacted and has a lot of nutrients is going to do much better than one that's not. Similarly, a human being following on the left here, a whole food plant-based lifestyle with good exercise, managing stresses, is going to develop a microenvironment rich in antioxidants and phytonutrients with strong blood flow, levels of inflammation, low levels of inflammation, and healthy organs, and a better life. And then, in contrast, most people live down there on the right side with processed and animal foods, sedentary lifestyle, and ischemias, low blood flow, and systemic inflammation, and get the results in the upper right, and wonder what's going on. It's not really a surprise. This is what happens when we give the wrong food for the wrong animal and end up with a significant imbalance. So good news, it's your choice. Choose the left side, be the guy on the left in that video or gal on the left, and enjoy a long, healthy life. As Allison mentioned, I do have my lifestyle medicine primary care practice. If you want more info on that, is here. Again, either screenshot or come back to the video if you want to learn more about what I'm up to these days. We also do lifestyle medicine group visits, lifestyle medicine consultations, and there are 9 others of us in our group who are lifestyle medicine certified and helping people to better health every day. We're also inspiring doctors across IHA and Trinity to incorporate this, because this isn't just something only lifestyle medicine docs do. It's really something that all providers are beginning to learn and understand, that this is, in many ways, a better way to get to the root cause. It takes a little work on your part, but it's so worth it. And I encourage you to follow through with at whatever level you want to do with it. So let's do the stop share and see what questions we have.
We have a number of questions, so I'm going to jump right in if that's okay with you.
Yeah, absolutely. Go ahead.
Okay. So a lot of people are wondering, why do you recommend taking B12?
Yeah, great question. Vitamin B12 is an essential nutrient that doesn't come from either plants or animals. It comes from bacteria. And our ancestors used to eat off the ground and drink out of streams, and they would get plenty of bacteria. Now that we chlorinate our water and wash our food, which we should, we don't get adequate amounts of B12 like our ancestors did. Animals still eat off the ground, so it goes into their blood and muscle, and therefore animal foods have a certain amount of B12, but especially as you move more towards plant-based, you want a reliable source of B12. Essential nutrient, which can, if in deficiency, can cause nerve dysfunction, challenges for brain function, anemia. So the stakes are high on that one, and we recommend 500 micrograms a day for everybody, and after 65, 1,000 micrograms a day. You can get your B12 levels checked with your doctor to help see what level might customized be worth it to you, especially after age 50 or if any age, if you're moving towards a plant-based lifestyle, you've got to take your B12.
Okay.
Someone else had asked about other vitamins.
Yes, there are a couple questions on supplements or other vitamins you might recommend.
Yeah. And the general principle is you should get your nutrients from food. The nature's vitamins houses are the fruits and vegetables, but also beans and whole grains. And these are your best sources for almost all vitamins. B12 is the exception for the reason I mentioned. Vitamin D is the other one, because we live in Michigan. We have 243 cloudy days on average, and many of the sunny ones are too cold. So we don't get near as much sun as our ancestors. And simply taking 2,000 units of vitamin D daily can help to offset that risk. You should take some ground flaxseed, chia seed, or walnuts on a regular basis to get your essential omega-3s. If some people are concerned they might have trouble converting the shorter chain version of those into the long chain, and therefore try taking something like fish oil. But we never recommend that because it commonly comes with a lot of contaminants, mercury, and environmental contaminants. The good news is the fish don't make the DHA, EPA, omega-3s. They get it from the algae. So you can bypass the middle fish and just get a vegan source of algae-based DHA, EPA, say 250 to 500 milligrams a day is now being recommended by many. Aside from that, save your money. You don't need calcium, probiotics, multivitamins, a whole host of things that the supplement industry is trying to sell you. Get it from food.
Is it helpful when you're transitioning to a plant-based diet to have supplements and then sort of back off on them? Or is it better to just go slow and easy?
Uh, so it's best to see plants are a better source for vitamins, minerals, and phytonutrients. So as you're transitioning, you're actually doing better than when you're on a standard American diet. Many of the processed foods have added synthetic vitamins, but without the phytonutrients that come along with the food, they don't work as well. So no, you as you transition, you're doing better on the supplement. And if you thought you needed to take a vitamin B or multivitamin because you weren't eating healthy, now even more reason you don't need it because you're starting to get it what you need from foods. So yes, we have a flawed concept there that you need vitamins from external sources when nature provides them in the form of foods. The best and safest are your green leafies. You can eat a big salad and you see your urine will turn that same bright yellow, just like if you took a multivitamin, because it's so rich in vitamins, they're overflowing. Yes, eat your vegetables, skip the supplements, except for those two and possibly three that I mentioned.
Okay. And is it ever too late to start? So if you've had a heart attack, if you already have arthritis in your knees, have you missed the mark, or can you start
No,
some improvement?
great question. It's never too late to start. No, that doesn't mean you're going to repair things that are already in the anatomic loss category. But you don't want to progress from where you are. You don't want to have another heart attack. You already know you're at risk for these things. So at the very least, if you're in a hole, stop digging. And many times we get surprised. Sometimes I see people with that new diagnosis of early stage chronic kidney disease or pre-diabetes. They go on a whole food plant-based diet and they say, hey, wow, my migraines are better. My arthritis has improved. My erectile dysfunction went away. I no longer need Cialis. What's going on? I'm like, yeah, just like when you stop smoking, everything gets better from where it is. Doesn't mean it's going to get perfect, but everything gets better. So no, as long as you're still alive, it's never too late.
Okay.
In
And
fact, in many cases, all the more important, if you've already had some kind of chronic disease diagnosis or previous TIA or stroke, all the more important that you now make that train's roaring down the tracks and you're at risk for another one. Similarly with cancers, we know that women with breast cancer or men with prostate cancer, if they switch to a whole food plant-based diet, start daily exercise, get good quality sleep, their chances of a recurrence of a cancer are much lower than those that continue doing what they were doing. We know that environment, food, exercise play a big role in cancer promotion, both development, promotion, and metastasis. We had a good seminar on this last night. Dr. Greger's next book is going to be all about cancer, but he's got several videos on cancer already. So if you go to nutritionfacts.org, you want to search, pancreatic cancer or colon cancer or whatever, you'll see the tie or the connection there. So yes, never too late, whatever you've got, to start living a healthy life and enjoying what you've got, at least better than you would have with continuing what you've been doing.
okay. So you talked about soy milk, I believe. Do you recommend any type of dairy, or what other alternatives are there other than soy?
Dairy is, of course, cow's milk, and cow's milk is nature's perfect food for baby cows. It's high in saturated fat, 51% fat. It's got cholesterol. It's 70% of what is not fat is lactose or sugar. Many people don't even tolerate that called lactose intolerance. It's got the animal proteins which stimulate IGF-1. Bacteria. It's commonly contaminated with these bovine leukemia virus, which has now been implicated in up to 37% of breast cancers. So bottom line is no dairy of any kind that comes from cows, sheep, goats, whatever. Every mammal makes milk for its infants and then weans them off it. When we humans take milk of another mammal and continue it even after infancy, adverse things happen. So I don't know if that was a question about do I recommend any dairy. Milk, cheese, yogurt, ice cream, cow's milk, and all should be as least possible, whatever you can get away with, ideally zero. As far as other milk alternatives, boy, when I started in 1977, it was bad tasting soy milk available only at the co-op. But now you've got hundreds of different varieties of everything from oat, almond, hemp milk, coconut milk. You've got soy milk, and all of these are way better than the cow's milk. Now, be a little careful. They're still processed plant foods, and read the labels to be sure they're unsweetened without a lot of additives and extras in there, because they can become ultra processed as well. So soy is probably the best as far as some of the isoflavones and other, but any of the others are good, whatever you enjoy. And then there's sub flavors within there. You can get the regular, the vanilla, the different sub flavors. But yeah, find milk alternatives. As far as alternatives for yogurt, same thing. They have cashew yogurt that's pretty creamy, kind of processed, but way better than the real thing. Watch out for that. Most of the cheeses, the processed cheeses are ultra processed foods. Again, are less worse than cow's cheese, but still not healthy. And you can make your own excellent cheese sauce. If you just Google vegan cheese sauce, sometimes some cooked potatoes along with some nutritional yeast, sometimes some cashews if you want to have raw cashews to make it creamy, makes a great cheese sauce to put on your broccoli. So alternatives can be made healthy, just like bean burgers can be made healthy, but Impossible Burgers are not. If it's made to taste like it was in the real thing, usually that's ultra processed and not healthy. But again, if these are stepping stones or transition foods for you, at least they are way better than eating the real burger or the real cow's milk.
Okay. And does charring vegetables from grilling, roasting, or pan frying have a negative effect on our health?
Yeah, good question. Cooking methods do vary and can have some effects. Some of the, I'm sorry, was it just about vegetables?
Vegetables was in the question, yes, but you feel free to expand if you have.
Okay. Some of the main concerns are for cooking meats. It forms what are called heterocyclic amines, which are carcinogens when you cook meat at over 260 degrees. So think grilling, frying, roasting, and these get into our system and can increase mutation risk and cancer risk. So cooking creates more of these depending on the cooking method. And all foods have some. So when you grill or roast an apple, for example, it goes from, say, about 15 units of these to up to 45 units. To put that in perspective, though, grilling chicken can go from 11,000 up to 15,000. So it's minimal for the harmful substances that may occur there. Another part of cooking, though, can destroy certain nutrients. For example, vitamin C is not heat stable. And if you cook vitamin C, it gets destroyed. So you want to eat some amount of raw foods to get your vitamins that can be destroyed with cooking. On the other hand, some things like the lycopene, which is a phytonutrient in tomatoes, is more bioavailable after you cook it. So sauces and tomato in the cooked forms can actually be better for you in that regard with respect to that nutrient. So and microwave is fine. Some people are afraid of microwave. It's not ionizing radiation. It just warms up or cooks your food. And in fact, can in many cases destroy less of the nutrients than other cooking methods. Cooking also releases the nutrients, especially in beans and whole grains, and destroys some of the phytates and other components that may not be as healthy. So you want to eat some of each, cooked and raw, and don't worry so much about the cooking methods. But be careful about frying because oil can add a lot of empty calories to your foods. Avoid deep fried foods, and if you're going to use oil, minimize it with cooking.
Are there any oils that are healthy per se, or that are less bad that you would recommend?
Yes. Yes, probably the worst is coconut oil because it's so high in saturated fat. They try to sell it because it's got medium chain triglycerides, but that does not offset the harmful effects of the saturated fat. The least worst oils are olive oil and avocado oil. Try to get the virgin uh, clean pressed olive oil with and just again use it sparingly, especially if you're trying to watch your weight. It's just got so much calorie density that it doesn't take much to end up uh, increasing it a lot. For example, a whole pound of salad is a good sized bowl, but 1 tablespoon of oil on there, and that's 100 calories for the vegetables, adds another 120 calories, just making that 60% fat. And you're thinking again, volume wise, no, 98% vegetables, 2% fat, but it doesn't take much to add the calorie density that can make it harder to lose weight. Um, yes, olive oil is probably the least worst. Just don't overdo it.
Okay. Can you explain what a phytonutrient is?
Oh, thank you. Uh, too, I noticed we've gone over 8 o'clock. I'm fine. I keep going here. I appreciate all the
Yes.
questions and engagement, but if people do have to go, you're welcome to move along to get the kids to bed or whatever you need to do. And are you recording this part too,
I'm
Allison?
recording the whole thing, and I was planning to
Okay.
go till about 8:30, if that's okay with you.
Fine. Yeah.
Okay.
Yeah, that's
Okay.
that's good for me. I just don't want people to feel like they have to stay or that they won't miss it if they want to come back on the reruns and watch the rest of the questions. But thank you all for hanging in there this long, and I'm here for you. Thank you. Um, the question is in phytonutrients. Well, these are somewhere between 30 and 100,000 nutrients that are not vitamins and minerals, meaning they're not essential to keep you alive, but they are essential for health. Examples include things like bioflavonoids in citrus that helps the vitamin C to work better and helps suppress inflammation in our bodies. The berberine in barberries, the curcumin in turmeric, the lycopene in tomatoes. And the general way to think about them is that they help to support all of the biochemistry and cellular metabolism throughout your body to help things function smoother. They quench inflammation, they support appropriate metabolism, healthy organ function, and really are, even though they're not essential to keep you alive, because you can put people on tube feedings with Ensure and keep them alive, but they are essential for health. If you're looking for optimal health, eat lots and lots of fruits, vegetables, whole grains, and beans, because phyto means plant, nutrient means nutrient. They only come from plants. Many cases, they're attached to the fiber. So that's why if you're eating white bread, not only do you miss out on the fiber, the protein, the wheat germ, but the phytonutrients that were in there have been removed as well. And many of them are only removed when they get down to your microbiome and they're munching away at the fiber, releasing the phytonutrients and get them in. So whole, unprocessed plant foods are the way to go.
Okay. There are a lot of egg lovers here, and they're wondering, I'm going to ask a couple questions here in one. So is the whole egg a problem or just the yolk?
There's
And
only two. Yeah, go ahead.
oh, and I was going to say there's someone who loves eggs and eats them several times a week, but very, very rarely eats red meat or fish or chicken. So
Yeah,
as they transition, can they continue to eat eggs? And even once they're transitioned, is that a safe thing to do?
yeah. Health-wise, there's only two problems with eggs, the yolk and the white. Sorry. You got it. You got it.
Yep.
The yolk, of course, is the source of highest density source of cholesterol and saturated fats, significantly increasing for heart disease, peripheral vascular disease. Even many cancers feed on cholesterol. Breast cancer, in particular, these cells like the high energy density of cholesterol. And sometimes we see women in late stage breast cancer, their cholesterol levels drop off significantly and thinking, oh, that's a good thing. My cholesterol is going down. No, their metastatic cancer is gobbling it up so much that it's dropping in the bloodstream. So cholesterol is not a healthy nutrient, contrary to industry whitewashing. And this is one of the main concerns for eggs. Um, uh, yeah, I don't want to get into too much detail there, but cholesterol really is a bad actor, and eggs are one of the highest sources. It is in the egg yolk. So again, that's where industry to the rescue. Just have your egg white omelet. Just use egg beaters, which are basically egg whites with some yellow coloring and some additives, and you'll be fine. You'll get the good part of the egg, right? The protein. Well, back to point number 2 about animal protein. Egg protein seems to be particularly harmful with respect to IGF-1 and stimulation, and therefore egg consumption is significantly correlated with cancer rates. Um, Dr. Kim Williams, the former head of the American College of Cardiology, noted a paradox. He said that, if you look at eggs and heart disease, it doesn't seem to be really strongly correlated, uh, especially as you might expect with the cholesterol component. And the reason for that is that eggs are causing so much cancer that people are dying before they have a chance to get their heart attack, and dead people don't get heart attacks. Um, so the egg whites, along with the fats and the cholesterol, are felt to be the main concerns with respect to cholesterol risk from eggs. Eggs also, if you look at what makes a food healthy, it should be high in fiber. Eggs have 0. Should be high in antioxidants. Egg beaters have the actual distinction of being one of the few foods, which is egg whites plus some artificial stuff, have one of the few distinction of few foods having 0 antioxidants. Remember, I mentioned the average plant foods have 1,100 units per serving. Average animal foods 18. Egg beater 0. So you're getting a lot of calories without the fire extinguisher to put out the free radicals that result from metabolizing those calories. Eggs contain choline, which metabolizes to the trimethylamine oxide, forming systemic inflammation. Eggs are acidic, hard on the kidneys. In short, the less the better. Now, if someone is saying, "Boy, I've given up red meat and chicken, and I can't give up eggs," that's okay. I mean, there's no right or wrong about this. There's no value judgment about how much you're doing. I should mention that early on, is that you can do whatever you want. I just think you should do it with eyes wide open. And understand what you're doing, that you're taking these additional risks because you like eggs, but don't eat them because you think you're healthy. By 2002, the linkage between cholesterol, saturated fat, and heart disease was overwhelming and unimpeachable. The egg industry, along with their friends at the dairy and meat industry, went to work. They hired experts. They designed studies that were really poorly designed, but sold a lot of Time magazines and medical journals and eggs in the process to kind of whitewash the data that clearly shows these foods are hurting us. Don't believe it. Again, I refer you to Dr. Greger's website, nutritionfacts.org. Just type in their eggs and you'll see a huge set of videos. I should mention 2 environmental contaminants. What the chickens eat is biomagnified up the food chain and goes into the eggs. Eggs are very commonly contaminated with salmonella, and should be thoroughly cooked just to prevent infectious disease. In short, you want to minimize egg consumption. But if it's what you really like and you want to do that, you should do what works for you. And it's certainly better to be an ovo-vegetarian than a lacto-ovo, and that's better than being an omnivore. It's like there's a stepwise progression of those. And then ultimately, what we find best, and there's a good series on Netflix called Live to 100, the Blue Zones experience, in areas of the world where people commonly live longest and healthiest, and called the Blue Zones. They're 95 to 100% plant-based and whole plant foods and unprocessed. And good news, you can mimic that yourself, opt out of the system that's creating the chronic disease rates we see, and enjoy health and vitality. Be the one on the left.
Okay, what about sugar substitutes like stevia? Worse or better than real sugar?
Oh, good question. It's a hard toss up. They're both horrible. Um, the sugar substitutes come in two different varieties. One is the totally artificial ones, like saccharin, and then there's the sugar alcohols, like mannitol and erythritol. And they're all designed to kind of make you feel like you're getting something sweet with lower calories. Seems like a good idea because, hey, you could enjoy what you want without the calories. The problems come multifold. Number one is that your tongue tastes sugar. We have sweet receptors, and it thinks sugar is coming. So the brain says, hey, pancreas, make some insulin, get ready to process this. As you create insulin, it's designed to move sugar into the cells, which never materializes, but it also puts fat into storage. It's kind of nature's hormone to say, hey, let's get this energy out of the bloodstream and into either storage or cells. So people on these don't actually lose extra weight. The second is a psychological effect as well. Since I'm having a diet pop, I can have the large fries. You know, it's like people justify in their mind that, oh, no calories here, so I get more here. And when you've done studies and they give people ad litem feeding, and those who think that they're getting the diet stuff end up eating just as many or more calories for that purpose. And then probably most important, as a most recent understanding, is their adverse effects on the microbiome. Many of these artificial sweeteners are not absorbed; they go down, and the bacteria in your colon have never seen this before. They are adversely affected by the sorbitol, the erythritol, and recently erythritol, which was felt to be one of the safer ones, is now directly correlated with heart disease and strokes. It appears that it increases platelet aggregation. It makes platelets stickier and more likely to clot. So definitely avoid erythritol. If you need it as a transition, see if you can get off it as quick as you can. And by the way, once you get away from excess sugar and artificial sweeteners, you find you no longer need it. It's like salt too. Your brain gets so used to these hyper palatable, sweet, fat, salt, sugar, that it doesn't taste normal without it. The opposite happens once you get away from them. Suddenly you're tasting the natural sweetness in fruits or even in carrots. You find that your tastes change and then things start to taste too sweet. So yes, work your way off from those two. They're synthetic industrial marvels that are making big profits for their companies, but not helping us health-wise.
Okay. Some questions about soy. Is it safe if you have to have soy if you've had breast cancer in the past? And does it impact other things like autoimmune disease, like thyroid disease?
Yes, great question. First of all, so if you've had breast cancer in the past, or if you're a woman, and basically all women are at high risk for breast cancer, 1 in 8 will develop it in their lifetime, you should eat lots and lots and lots of soy. Soy is protective against breast cancer. The phytoestrogens in soy, we used to think, or the dairy and meat industries were making people think that these phytoestrogens were going to stimulate, and many breast cancers are stimulated by estrogen. And the theory or idea was that, oh, these are going to create it too. The exact opposite happens. These phytoestrogens plug in and block the receptors from other estrogen, decreasing the risk of transition to cancerous cells, promotion or metastasis of the breast cancer. So multiple studies now have shown that the more soy women who've had breast cancer eat, the lower their chance of reoccurrence. With respect to thyroid disease, there are different types of thyroid disease, hyper and hypothyroidism. Bottom line, it's not enough of an issue to worry about it. If you have or have had thyroid disease, still healthy and good to eat soy without worrying about it.
Okay. We've talked about weight, I think, a little bit in the past, and there are a couple questions about that. People losing too much weight when they shift to a plant-based diet. How do you combat that?
Yeah, good question also. Because these foods are so much less calorie dense, and we tend to eat about the same amount of food just kind of by habit, it means you definitely need to eat more. Now, in many ways, this is an advantage. I pull up to a huge salad and a bowl of soup and some side, and then I go back for seconds. People are like, "How do you eat so much and stay so thin?" I'm like, "Well, the calorie density here isn't enough to make me gain weight. And it's really the key to both losing weight and preventing that from coming back on once you do. So low calorie density foods are your key to maintaining a good weight. Now, as you mentioned, as a kind of person with a question mentioned, is that sometimes people still eat the same amount they had been in terms of volume, and they're basically starving. They are losing weight. You need to eat more. Have a second bowl of oatmeal, get some quinoa and the chickpeas on your salad, eat 2 bowls of soup, eat lots in order to nourish your microbiome. That 100 grams of fiber that you're targeting needs to come with a lot of food. Also, look for if you're feeling like you're having trouble maintaining weight, look for more calorie dense foods like nuts and seeds, sweet potatoes, whole grains, and beans are your best. Fruits and vegetables just really don't have enough calorie density to get you all you need all by themselves. It would be hard to eat 20 pounds of vegetables a day just to get 2,000 calories. So eat more, and avocado too can be a higher calorie density food that in its whole natural form can be healthy as well. A lot of people worry about muscle loss as they age, and that then do they need to eat eggs or protein? Again, common mythology put forth by the keto, carnivore, and animal food industries. Dr. Greger has a good section in his book, How Not to Age, about sarcopenia, muscle loss as we age. Bottom line is you do need more protein, maybe 20% more in the range of 1 gram per kilogram, but that's not hard to get. You can do that by just eating more beans, tofu, whole grains, nuts, and seeds. Remembering that average American eats 2 to 2.5 times the protein they need, and that's plenty to maintain and build muscle mass. The key to maintaining building muscle mass is get to the gym or to your resistance training or go for walks. Work out, do something because your muscles are use it or lose it kind of apparatus. And your food, just like for gorillas, elephants, and draft horses, who make the biggest muscles in the world, all out of plants, you'll be able to do the same.
Okay. And there are some people who are saying they worry about plant-based shopping and eating on a budget. And then there's also questions about organic versus non-organic fruits and veggies. Is it safe to eat non-organic fruits and veggies in this kind of a quantity?
Wow, people are really engaged. I got great questions here.
Ah.
Thank you. Let's start with the organic first. Organic is incrementally better for a couple reasons. One, less pesticide exposure. Obviously, you're not getting as much of those contaminants in, and those can have adverse effects on as you're trying to lose weight, and prevent cancer and stay healthy. So organic is better in that way. Interestingly, also, plants that are sprayed with chemicals don't have to put up as many defenses against bugs. And so they don't develop as many of the same phytonutrients as ones that are organic. So organic vegetables and fruits are actually healthier in terms of more phytonutrients. Those defenses the plants use to defend themselves are ones that we use then to quench cancer or decrease inflammation. So there is some incremental benefit there. But I don't want perfect to be the enemy of good with respect to organic, because even conventional fruits and vegetables have so many huge benefits with respect to phytonutrients, fiber, vitamins, minerals, and healthy benefits, that the small amount of contaminants or the slight decrease in phytonutrients in there is not worth going out of your way or spending more than your budget to get that. Remember that food contaminants biomagnify up the food chain. So animal foods have an average of 13-fold, that's 1,300% more environmental contaminants, especially in fish, which are filled with microplastics these days, mercury, PBBs, PBBs, PCBs. So yes, if you can afford it and it's convenient for you, get organic, but don't let that get in your way of enjoying fruits, vegetables, whole grains, and beans from a conventional type as well. With respect to cost, this is a common concern as well. It turns out that we have government subsidies. Our taxpayer dollars are going towards subsidizing these food industries through corn and high fructose corn syrup gets to be very cheap. The feed corn a hamburger would cost $18 if they let it float to what it really should be. So people get the idea that, well, I can eat at McDonald's for cheap or here. But two things about that. One is that you can still eat healthy on a whole food plant-based diet. I mean, rice and beans are some of the least expensive foods. You get the regular beans, you soak them overnight, cook them. Those are great. Vegetables and fruits you can get frozen, which in many ways are even more healthy in many ways because they freeze them at the peak of ripeness. They're less expensive. You can use them off season and ways of combining them. And then fruits and spices and herbs and spices add flavor to these for inexpensive because all you need is small amounts. So no, many studies have shown that you can eat for less money on a whole food plant-based diet. And then beyond that, you got to think of the total cost. It's kind of like greenhouse gases is how much is the total of this particular item. In the cost of food comes the cost of future ill health. So medication copays, lost work, productivity, nursing home costs all come along with the cost of that cheeseburger. Even though it may be less expensive today, your future costs are more than enjoying vibrant health. And I guess it goes without saying, health is priceless. You can't buy that. And so choose healthy foods. You won't have to pay more. And even if in some cases it is a little more to get foods you like, it's so worth it in the long run.
Okay. I'm going to just pull like one or two questions together here. How about honey?
Honey is sugar. It's a split sugar, so it's a little sweeter per amount than table sugar. If you really like a little bit on your oatmeal and it's your way of getting it down, that's okay. But once again, the less the better. Honey, maple syrup, agave are all just different forms of sugar. They have a very high glycemic index, which means they spike your sugar, insulin release, fat storage, empty calories. So again, not to throw cold water on it, if a small amount, even a teaspoon of sugar is only 16 calories out of your 1,800 calories you're eating a day. If it helps you to get down and enjoy some other foods, a little bit of honey is not that big a deal. But don't think of it as healthy.
Okay. And lastly, there are a lot of people who have digestive issues, so leaky gut, chronic diarrhea, IBS, and I think a lot of these people are nervous to start a plant-based diet because
Yes.
they feel when they eat vegetables. So what are your thoughts on that?
Yeah, great question. A part of what you're seeing there is that your microbiome is so out of balance from not eating these foods that when you try to eat them, what I mentioned in the backlog effect, or I'm sorry, in the why you might feel worse at first section, is that the microbiota that help. See, we have outsourced carbohydrate metabolism. There are over 1,000 different carbs in nature, and we only did just 13 of them. Our microbiome helps to metabolize and digest the rest of them if they're there. But if you haven't been feeding them, they're not there. So you eat them, these foods ferment, form gas, irritation, bloating. You think, oh, I can't tolerate that. I don't tolerate beans or broccoli or whatever. So the key to that, and a really good book I was looking for here called Fiber Fueled by Dr. Will Bulsiewicz, Fiberfueled. And Dr. Bulsiewicz is a gastroenterologist who deals with these kind of problems all the time. IBS, Crohn's, ulcerative colitis, inflammatory bowel disease, even colon cancer, are largely related to the foods we're eating and the lack of healthy whole plant foods in the diet. So you get into a negative cycle where, oh, you can't eat them, so you don't get the microbiome, so you can't tolerate them, so you don't eat them even more, and you end up with worse and worse symptoms and problems. I should caveat this with you also need to see your doctor. You need to rule out more serious conditions and not just do this. But don't think that an intolerance of a certain food means that you can never take it. As I say, Dr. Bolshewitz talks about if you can't tolerate lentils, start with just a teaspoon a day of canned lentils. Those are pressure cooked and more of the nutrients partly digested. If you tolerate those, a tablespoon, a quarter cup, you work your way up, and then do the same with chickpeas or black beans, broccoli. You'll be able to work your way up with that. Some people in the transition phase find that enzyme containing a product called Beano can help them. It's little chalky tablets. You get it at any pharmacy over the counter, and you chew it with your meal. And while you're in that transition phase, it helps prevent the gas or bloating from your digestive issues. Sometimes irritable bowel syndrome is due to FODMAP intolerance. These are called fermentable oligo and polysaccharides. And you can search for vegan low FODMAP diet. Think of low FODMAP diet not as a diet you stick to for a long time, but it's a temporary elimination diet to see if you can eliminate your symptoms and then gradually work back on the foods like garlic and others that contain these FODMAPs and work your way back up. Some people have a gluten intolerance, but it's a lot less than most expect. About 1% have celiac, which is a genetic inability to digest gluten present in wheat, barley, and barley, and about 1% have an intolerance that's more related to their microbiome or their own system, and they may be able to rehab that, just like we talked about for the others. Yes, I guess that was a long and kind of sciencey answer to the question of with these GI symptoms. Just like the lungs take the brunt of smoking and people develop emphysema, chronic cough, chronic bronchitis, lung cancer, the GI tract takes the brunt of the standard American diet. The fiber deficient, phytonutrient devoid, high fat and protein diet totally upsets our system, which is ideally designed for whole plant foods, and puts it in such disarray that it can then no longer tolerate these things. But Crohn's disease, ulcerative colitis, IBS, our inflammatory bowel disease are commonly reversible. And Dr. Bolshewitz has presented several cases at national conferences. Another gastroenterologist from England, Dr. Alan Desmond, Desmond, wrote a book called The Plant-Based Diet Revolution, is very good at helping people to understand this. I think both of them have YouTube postings. Good news, even though you seem like you're in an endless loop, like I want to eat healthier, but when I do, I get worse, there are ways to help manage this and get back to what you know is a healthier diet for your whole system and can often turn around your GI symptoms. Similar with GERD, hemorrhoids, I don't know, name almost any GI condition, gallstones, fatty liver. These are all parts of manifestations of the standard American diet, or SAD for short.
It's interesting to compare it to smoking, because when you quit smoking, your body can have a really hard time giving up those cigarettes. So it's these big transitions from something not so good to something good. Can
That's
take
right.
time.
Yeah.
So, okay, there are a lot of questions about you, about how to see you. And so yes, you are accepting new patients. We will have contact for your practice in the email that we follow up. But as you mentioned, we also have several other primary care providers throughout the Southeast Michigan area. So if Ypsilanti is not your neighborhood, we have people in Brighton and Oakland County, and kind of scattered throughout. So we should be able to help you find someone close by to you that can kind of help you with this if this is of interest to you.
Yeah, that's right. We all do, or several of us do consults for, it's not like taking over as your primary care doc, but seeing you for a consultation and then sending notes and information back to your doctor to help them manage from a lifestyle perspective and get your questions answered. Group visits are great for that too. We get together with anywhere from 4 to 10 people and help support each other, answer questions from things you might not have even thought of. I do those weekly at EMU or virtual. We have virtual group visits as well. And then my lifestyle medicine primary care practice. We should mention, because I do take longer with people to help get to the root cause of things. And we have a team approach with our health coach, nurse manager, Nan, our exercise physiologist, RJ, lifestyle medicine trained nutritionists, pharmacists, behavioral health specialists. All of that's not covered by insurance, so it is a membership model. That which is my primary care practice. Again, info is on that last slide. Or if you even just Google IHA lifestyle medicine, you'll be able to see the universe of what we have offering. I should mention too that our hospital colleagues in the nutrition department are very good at lifestyle medicine as well. And they have a class called the Foundation Series, which goes through all 6 of the pillars. They have free cooking classes, one called Cooking with Plants, Tuesday evenings, virtual. We can include info and connections on that as well. So yes, lots of great resources both in our community, nationally, and available online for those seeking to advance your health and, again, in the long run, make a plan for your future self to be that one on the left where you're active and vital well into your elder years.
Okay. Well, thank you. You delivered our marketing message so beautifully. So I don't have to do it. So thank you so much, Dr. Breakey. This is just so rich with information and inspiring, and I'm so grateful that I get to host it and watch it myself. So thank you all who are still with us for joining us tonight. We hope that you're inspired and look for this recording to arrive in your email in the coming days, as well as many of the resources that Dr. Breakey spoke about tonight. So again, thank you, Dr. Breakey. This is wonderful.
Oh, I appreciate it. Allison, if I could just say one more thing.
Of course.
Be a little careful as you make this transition that you could get so much better quickly that you need to decrease your medicines. For example, people on high blood pressure or diabetes medicines that are holding their blood pressure down or their blood sugar down start eating healthy. They no longer need those and they push them too low. So they might feel a low blood sugar or a lightheadedness or blood pressure. So let your doctor know if you're going to be doing this and get ready to start de-prescribing the medicines so that they don't cause you side effects or concerns. There's no downsides to trying this, and you might just have better health in the process. And inspire yourselves. Thank you so much for your time this evening, and go forth and be healthy. Have fun with it too. This isn't meant to be depriving. This is meant to be engaging and help you to expand your ability to find healthy new foods, lifestyles, exercise patterns that give you satisfaction as you go through life. So thank you.